Thank you for joining me for another episode of the Your Longevity Blueprint podcast. Today I have Dr. Anshul Gupta. He is a board-certified family medicine physician with advanced certification in functional medicine, peptide therapy, and also fellowship trained in integrative medicine. He has worked at the prestigious Cleveland Clinic Department of Functional Medicine as a staff physician along Dr. Mark Hyman, and he now specializes in treating Hashimoto's disease to help people reverse their unresolved symptoms of thyroid dysfunction. Conventional medicine doesn't have all the answers for a vast majority of patients suffering from Hashimoto's, and that's where functional medicine model can be very helpful. Dr. Gupta makes personalized functional medicine plans for people with Hashimoto's to end fatigue, reduce brain fog, and lose weight substantially. Through his three-step process, he not only heals the thyroid, but also rejuvenates mitochondria to help females with Hashimoto's to live their life to the fullest. So welcome, Dr. Gupta.
Yeah, thank you so much, Stephanie, for having me on the show.
Well, tell me your story. Tell me about yourself and how you got interested in functional medicine.
Yeah, absolutely. I always have this joke around, with all my colleagues is that each of us, who venture out into functional medicine has a story behind it. So similar to that, I have my story. So my story starts with, after my residency of family medicine, I started working in rural Virginia in a busy traditional practice. I was just 32 at the time. I was working hard. At the time, I started having some health issues. So I started having this stomach pain, which was very, very excruciating, and I had no apparent reason for it. Then I started gaining weight along with it, and I was feeling much more fatigued than I've ever felt in my life, and then I was having some brain fog issues. Again, I could not put all these things together. The major complaint was the stomach pain because that was bothering my life like everyday basis. So being a physician, I thought can treat myself, so I started doing it. So I started taking some medications, but it was not helping. I kind of added more medications to see if that would do the trick. But that was not working either. So I thought, oh, well, maybe I'm not smart enough. I need some other doctors to kind of get on board. So I spoke with my colleagues, who are like specialists, GI specialists and stuff. So one by one, actually, I saw so many different specialists and nobody had an answer. They literally did each and every investigation that you can think about. They scoped me from top to bottom. They kind of scanned me. They did CAT scans, ultrasounds, allergy testing, everything. And nobody could figure out why I was having this stomach pain. And I was like, really? I mean, I'm just 32 and nobody can fix me. That is just that is not done. And after a while, actually, it was not funny anymore. It was getting depressing because, I was getting this stomach pain, which was affecting my quality of life. And it was so sudden that in the middle of my work, seeing patients, this pain will hit me suddenly. And, I didn't know what to do. So it was very, very frustrating. I started losing hope, I was like, okay, I don't know. Is this the way I'm going to live the rest of my life?
Right.
And when I spoke with my other colleagues and they said, well, maybe you just have to take these medicines and they will eventually work for you. I was like, are you kidding me? I'm taking 4 medications and you're telling me eventually they will work for me? I was like, that is not satisfactory. So I was like, don't know what to do. So then, obviously you start looking around. So then, somebody suggested functional medicine and I started looking into it. So then they have different modules and I started kind of training myself in one of the GI modules they have.
Yeah.
And then after the training, I started implementing it. And you will not imagine, within 1 month, my pain was gone. And then in 6 months' time, I was off all the medications. I had never had any pain and I was down 40 pounds.
Wow.
Yeah. So that
It's
was
amazing. It's amazing to hear, right? But it's also depressing that it took you how long, how many doctors getting scoped from head to toe, how many medications, and then and who knows how much all that cost, and then you on your own finding essentially your path to healing. So it's exciting, but it's also actually depressing that that conventional medicine doesn't have those answers, that so many patients are not well served until they find functional medicine.
Exactly. And that was why should I not be knowing about these things? If we have an alternative way of helping, patients out or helping me out and, nobody's even talking about it. So that was, as you said, just so kind of annoying at times that, why should we not talk about it? But also happy at the same time that I can help out people like me now.
Right. That's the silver lining. Yeah.
Yeah.
So it sounds like with your personal story, you had a lot of gastrointestinal symptoms, which actually can relate to Hashimoto's, and I know that's something you specialize in. So at what point did you get interested in Hashimoto's and treating those clients?
So then, when I went into working for functional medicine clinic in the Cleveland Clinic Center,
Yeah.
so then I started looking like different kinds of patients, and a majority of a lot of those clients were like Hashimoto's, and I started finding some similarities, which what I went through in Hashimoto's. So they were all having gut issues, they
Yeah.
were all having like fatigue issues, they were all having difficult time in losing weight, and they were all having brain fog issues. And the worst was that they were all losing hope. you
Yeah.
know so they have seen all these specialists, like endocrine specialists and family doctors and their PCPs, and they will all say that, well, your numbers look good, you're taking the right medication, maybe this is the way you probably will have to live rest of your life. And again, these were like females, in like middle-aged females in the prime of their life, and they were
Yeah.
like, I cannot live this way the rest of my life.
Absolutely. I all the time, every single day, see patients who come to my office who say, well, either they haven't had their antibodies tested or they have, but their doctor says there's nothing we can do about it. So basically, just keep on taking the medication, or some of them aren't even on medication, but they're told there's nothing that we can do. And so they're kind of in my office as a last hope because they don't know what else to do, but they know something's not right, and they know that help should be out there. They're just looking for it.
Exactly. So I started digging deep into the research part of it because, I'm kind of a more like an academic person. So I started looking in research side of it. What does it say? So then, like there was a lot more research about it, like, how we are misunderstanding Hashimoto's, and, what are the other things that we can do to help out with it. And I started developing a protocol, over there to help, these clients. And then I started implementing it and saw phenomenal results. Patients were, getting, their brain fog was gone, their fatigue was so much better, they were like losing weight, and most of all, like they were feeling much better and they were living their life to the fullest now. So that was the most, like rewarding part of it.
Sure. Well, I want to know what that protocol is, but I think we should rewind a bit because we should define Hashimoto's. So first, let's define it. What is Hashimoto's?
Yeah, absolutely. Like an important question. So Hashimoto's is an autoimmune thyroid condition. So in that situation, what happens is that, our body starts producing antibodies against our own thyroid gland. So like over the course of time, these antibodies starts destroying our thyroid gland, and which ultimately leads to what we call as hypothyroidism. And then, like that's the time that, most of the Hashimoto's patients are diagnosed when they check, their thyroid hormones, which is just essentially TSH. And they say, oh yes, you have hypothyroidism, you just need to take a levothyroxine or thyroid hormone, and that will fix it. But
Right.
nobody ever kind of, talks about Hashimoto's, or why did they get, this thyroid issue. So that's where, like the Hashimoto's is a little bit different than a regular thyroid problem.
Right. But it's one of the top causes for the thyroid problem, right? So I like to tell my patients it's more of an immune disorder, right? The immune system is attacking the thyroid. We literally are seeing antibodies to your thyroid in your blood, which probably started long before, for many
Mhm.
cases, long before the thyroid function actually tanks and patients, become very symptomatic. So with conventional medicine, and I want to talk a little bit about labs here, but with conventional medicine, usually hypothyroidism is diagnosed based on a TSH alone. So you go to the doctor, you say, I'm tired, they screen you, they run a TSH, it might be normal, they might say you're fine, or it might be high. If it's high, that's more of a brain hormone. So I tell patients that's your brain screaming at your thyroid to spit out more thyroid hormone. But as a late mentor of mine, Joe Collins, once said, which I will never forget, he said TSH stands for too slow to help. Because by the time the TSH is high, many times the T4 and T3, the most important thyroid hormones, are really low and patients are really symptomatic. So it's very important that these patients have a comprehensive thyroid lab screen. Do you want to speak to that a little bit?
Yeah, very important point. As you mentioned, there were several of the clients that I see in my practice, who have been diagnosed with thyroid disorder, but they never has been checked for, like Hashimoto's.
Right.
And it's so like appalling to me, like how is that possible? So as you said, conventional medicine, the only, like thyroid hormone that you need to check for a diagnosis or even management of thyroid dysfunction is just TSH, which absolutely is not enough, right?
Right.
Because TSH is just one hormone, and as you said, by the time the TSH is abnormal, we are already at a very, very fairly advanced stage of thyroid dysfunction. So we need to do a complete comprehensive panel to kind of evaluate the thyroid completely. So then that I kind of divide into, like, first of all, thyroid hormones. So we need to check a TSH, we need to get, your T3 hormone levels, T4 hormone levels, total and free, and also reverse T3, just to kind of know, where all this stuff is happening. Most of the conventional doctors or endocrine doctors will not even know what reverse T3 is. So that's a different story, right?
Which
And
I want to
then
get
this,
to. So we'll come back to that, but keep talking. Yeah.
yeah. And the second part is antibodies, right? So check for Hashimoto's antibodies, which again involves like the TPO antibodies and the thyroglobulin antibodies. So those are the two antibodies you like to check. The third part, actually, I add also inflammatory markers, like, HSCRP and ESR, and ferritin levels, just to see like how much inflammation is there. Because again, these labs have never been checked in majority of my clients, and they don't know whether they have inflammation or not. So that's where I divide my thyroid testing in these three big categories, like thyroid hormones, antibodies, and also inflammation markers.
Wonderful. And for those listening, we will put all these labs in the show notes so that you can reflect back and know which labs you need to have your doctor check on you. With ferritin, when too high, that is an inflammatory marker, but some patients have low ferritin, which is your iron stores. And iron or ferritin are really required for thyroid hormone production as well. And a lot of my thyroid cases, I have anemic patients. Their iron and ferritin are low, and we have to optimize those to improve thyroid function.
Absolutely.
But let's go back to reverse T3. So what is reverse T3?
Yeah, so we have, like, as I said, we have different kinds of thyroid hormone that our body produces. Like, to kind of just give you a quick update on anatomy so people can kind of follow along. So, first of all, we have this master gland, which is the pituitary. Okay, that produces the hormone TSH, which goes into your thyroid gland, which tells us to produce the thyroid hormone. And it produces basically T4 hormone, right? And then the T4 hormone needs to be converted into T3, which is your active thyroid hormone. Now, during this process, we also produces what you call as a reverse T3, which basically antagonizes this, T3. Okay. So what I call is that if T3 is your gas pedal, reverse T3 is your brake pedal. Okay. So, like a lot of times, like people come to me saying that, okay, well, like my thyroid numbers look good. My T3 is good. T4 is good. Why am I having problem? I said, let's check your reverse T3. And the reverse T3 is super, super high. So basically, even though you have good amount of T3, but the functioning of T3 is hampered because the reverse T3 is too high.
That's great. That's the exact analogy I use with my patients. You don't want your brake pedal on and your gas pedal off, right? You don't want to have high reverse T3 or low free T3. So if reverse T3 comes back high, then what do we do? What is that a sign of? What does that tell us?
So there are various things, which kind of play a role in kind of having reverse T3 being high. So first of all, I kind of go into the like root cause analysis. Okay, well, what is going on in your body, which is asking your body to make so much reverse T3? So in that situation, sometimes some nutrient deficiencies can do it. Our poor diet can also play a role. And then third, stress, is a very, very important factor, which can also kind of, cause reverse T3 to go high.
Wonderful. So maybe those responses answer the next question that I was going to ask you. Like, why do Hashimoto's patients continue to suffer with symptoms and they don't get better? Can you maybe answer that question and start walking us through briefly your treatment protocol for Hashimoto's?
Absolutely. So like initially, as I mentioned, like, we are categorizing Hashimoto's in the same category as what you call as low thyroid or hypothyroidism. While Hashimoto's is a total different disease, right? As you mentioned, it's an immune disorder, right? So it's an autoimmune disease. So actually in Hashimoto's, what is happening is these antibodies or autoimmunity in our body, which is destroying not only thyroid, but also an important, another organelle called mitochondria. And because of destruction of thyroid and mitochondria is actually causing people to have all these symptoms of brain fog, of hair loss, of fatigue, weight loss issues, all of that stuff. And we think actually it is because of deficiency of thyroid hormone. So we keep pumping people with thyroid hormone without any relief, while we are not doing anything with the root cause of the problem, which is destruction of thyroid and the mitochondria.
So here's where the mitothyroid connection comes in that you talk about.
Exactly.
So what do
So
we do
just go.
for our mitochondria?
Yeah. So first of all, let me kind of define mitochondria because again,
Yes,
most people
please.
might not know about it. So in a biology class, like just we learn only one line about mitochondria. That is the powerhouse of our body. Okay, which is the case. But so like our body has like millions of cells, right? And each cell of our body has these teeny tiny structures in it, which are called mitochondria. Okay, so these mitochondria are actually required to power our body. So these are basically, again, as the word says, powerhouse, that they are powering our body and giving us energy. Without mitochondria, we will not be there. We cannot function, we cannot live. But the interesting piece is that we thought 10 years ago, 20 years ago, that mitochondria is only involved with energy production. But now the new research says that mitochondria is involved in many more things. It regulates our immune function. It is involved in aging process. It is involved in autoimmunity. So it is involved in so many different things that now there is more and more research coming into it.
And I've had previously several guests talk about eating clean to fuel your mitochondria, or certain supplements like NAD to fuel your mitochondria, or peptides to help with mitochondrial function. So, which I know you're an expert in also. So there are a lot of things that we can do to improve our mitochondria. So what are your top tips for that? You can repeat some of what I just mentioned, but what are your top strategies in your patients to restore that mitothyroid connection?
Absolutely. So what I do is that I do for me like the top three things which help with like restoring the mitothyroid connection. The first is the mitothyroid diet that you have.
Okay.
So food is so important, like it just plays in like a pivotal role in kind of helping our body to heal. So in mitothyroid diet, what I do is that like I remove first of all foods which are destroying this connection. Okay, so those are the foods which are inflammatory to our body, which is like mainly gluten, dairy, soy, corn, peanuts, sugar, processed meat, and processed food, all of those things. So we remove those foods to make sure that we are not doing anything to destroy this connection further. And then we introduce along that, we introduce foods which are healing to thyroid as well as mitochondria. So first category of foods is vegetables. Okay, so the green leafy vegetables and colorful vegetables. So the more color you have in your diet, the better it is. So I always ask my patients is that make sure at least you have 8 colors in your diet every day. Okay, and always make a joke. Make sure those are not M&Ms.
Oh yeah.
So because it was an interesting story. Like one of my patient, I told her like eat as many colors as you like, and she's actually literally started like coloring her food by artificial colors and eating it, thinking that is
No.
it. I
Yeah.
was like, how? So that was very funny. Uh, so as I said, green leafy vegetables and colorful vegetables, that's
Okay.
one thing that we want to do. The second thing is that good fats. So that's where, we introduce, like your olive oils and avocados, and then ghee, all of those, good fats in there.
Sure.
And then fatty fishes, good fatty fishes, omega 3s, from them. So that's the source, that we would like to introduce that. Then we reduce the amount of carbohydrates in their diet, so that again the mitochondria can regenerate and actually can power through that. So we do that also. So those are the kind of things that we do. We all obviously introduce a lot of nuts and seeds in my diet, because I like just I like the way the body works on those nuts and seeds with them. So that's the first thing that we do, the mitothyroid diet, kind of, introducing all of these things to them
Sure.
and working to rejuvenate their mitochondria and thyroid together. Then the second thing that we do along with this diet, I introduce intermittent fasting.
Okay.
So intermittent fasting, wonderful way that rejuvenates the mitochondria, and then lower down the autoimmunity, saves the thyroid gland, reduces, the burden of oxidative stress, kind of, helps to rejuvenate the thyroid that way. And that's the second part that I help my clients to introduce that.
Can
And the
you
third thing is
define what that is too? For more details, I did interview Cynthia Thurlow. We had a wonderful, lengthy podcast on intermittent fasting that I recommend listeners go back and listen to. But briefly, tell the listeners what intermittent fasting is. Yeah.
absolutely. So again, going back to 100 years ago, our body is not used to having food 24/7, right? So we had brief periods of time, maybe like hours or days, where we will not have any food, right? And that's the way actually our body was used, was made up, that when we have no food, then we'll use all the fat stored in our body to kind of burn it, and kind of our mitochondria will be able to rejuvenate that way. So intermittent fasting is actually using the same kind of methods to rejuvenate the mitochondria now. It's because now we are eating 24/7, there is no time that we don't eat, like all the time. Food is so much available now these days. So in intermittent fasting, we have a span of time where people will not be eating, so that they go into that little bit of what we call as a starvation or a ketosis mode, which switches how mitochondria makes energy, because our mitochondria can use two kinds of fuel. One is carbohydrates and one is what we call as fats. Okay. So when we go into that starvation, or when we go into that ketosis mode, we are using fats to burn, which has a lot of benefits to it. So the typical time, when what is needed for this intermittent fasting or the fasting window is at least 12 to 16 hours. Okay. So you need to fast for between 12 to 16 hours. Most of the people will do 16 hours of fasting and 8 hour of window where they will eat food. Okay. Like it will work for majority of the people, but for some people it is very, very challenging. So I will say that if they can even do 12 hours of fasting, that is also great.
Sure. Every single day, do you have patients cycle in and out of that, or change the feeding window hours, or just kind of just every day about 12 to 16 hours?
So I'd like to do it 12 to 16 hours, because I generally don't go till 16. My clients most of the time do between 12 to 14, and I
Sure.
just have them do it all the time. If somebody's doing 16, then I generally cycle them like for like 5 days or so, and then kind of give them a break for a day or two,
Sure.
and then do it again.
So to the listeners, that means stop eating right by 7 p.m. or whatever time you choose, and then don't eat for another 12 hours. So you wouldn't eat breakfast until 7 a.m. if you want to do 7 to 7, and a 12-hour fast or the 12-hour feeding window. Or if you can wait till 9 or 11 a.m. to eat, then you're extending that out. So I would start with 12-hour and then slowly work your way up if you can to a longer fasted state.
Absolutely. Yes, that's the way to do it. Like again, if you're feeling miserable, then you need to do a shorter window. But if you don't feel miserable, most people actually, I find it that for them, it's easy to do 14 hours to 16 hours. You
Sure.
just need to do it slowly, as you said.
Sure. All right. What's next?
Third thing is supplements. So we all love supplements, but like especially for restoring this mitothyroid connection, we
Yeah.
need some supplements.
Yeah.
So some of the supplements that are on my list, are NAD, which as you said, you have already been covered on the show. But NAD is wonderful. NAD is a substrate which is basically needed for mitochondria to produce energy, and then as we age, or as our body kind of goes through a lot of autoimmune processes, our body cannot keep up with producing NAD, and that's the reason that level decreases. So sometimes we need to supplement NAD for
Sure.
it to work.
What's your favorite
uh,
form? What form? I have a sublingual NAD here that I recommend to many patients. What form do you recommend usually?
yeah, I'm actually trying to figure, working with different kinds, because every day there is a new NAD which is coming up. And then like for interestingly, for my client, there has not been one that works for them, but I like the sublingual one too, which again works great. That's also the good one.
So NAD is one supplement. What are a few others?
So acetyl L-carnitine, that's another one which kind of powers your mitochondria. The
Yep.
third one is CoQ10, which is kind of very powerful and has been there for a very, very long time.
Yep.
So again, different versions of CoQ10. The one that I like is MitoQ. I think that it gives the most benefit to most of my clients.
Sure.
So that's the third supplement. The fourth is magnesium. I feel that magnesium is so powerful in mitochondria and often missed.
Yeah.
Magnesium doesn't get the same limelight as all of these others, but I think it is very, very powerful and very, very useful.
I totally agree. I think some patients say, well, I tried magnesium and it didn't work. Well, what form did you take? How much did you take? When did you take it? There are a lot of questions that I ask. And I myself have even experimented. I get a lot of palpitations and magnesium is helpful, but usually more magnesium is more helpful. So
Yeah.
some patients need to find that therapeutic dose for them of magnesium. Magnesium not just important for mitochondria, it's really important for hormone production. It's essential for thyroid hormone production. It's great for sleep. It's just great for everything. So most patients do need some magnesium. While we're
Yes.
on the topic of supplements, I want to kind of overlap what you've said with the top supplements for thyroid health also, since we're talking about, Hashimoto's here. And obviously supplements for mitochondria are going to influence the thyroid because of this mitothyroid connection that you've talked about. But earlier in the episode, you alluded to T4 converting to either free T3 or reverse T3. And obviously we want it to convert to free T3. There are some cofactors that are needed for that conversion. So can you talk about what cofactors or what nutrients are needed there and just needed for the thyroid in general? What supplements you use there?
Yeah, so there are good like a few supplements, which are essential for like optimal functioning of the thyroid. The top of the list for Hashimoto's patients is selenium. Again, wonderful supplement which helps, a lot of thyroid patients, especially reduces the autoimmunity and antibody production. So selenium is number one. Second one is zinc. Again, an important, like cofactor which is needed for conversion from T4 to T3. So that zinc is the second one. The third one are B vitamins, B for boy. So B vitamins are also needed at different steps for, like thyroid hormone production.
Sure.
And the fourth one is iron. As you said, a lot of females are anemic, so they don't have enough iron, so I want to make sure that they have enough iron in them. The fifth one is controversial, which is iodine. Like there are two different camps of thoughts. Like one camp thinks that everybody should get iodine. The other camp thinks, well, iodine might not be that great. I'm in the second camp. So because the research does say that, very low iodine is also bad and very high iodine is also bad. So what I do for my clients is I check their iodine levels. And if it is like, in the upper normal range, I generally just, kind of push for iodine containing foods. I don't give them a supplement. But if their levels are low, then I give a supplement for a short amount of time.
I totally agree. I've seen iodine really help patients and I've seen it really backfire on certain patients. So I feel like there just isn't one blanket rule for its use. We have to assess, like we have to test levels and try it on patients and see what happens. Did their antibodies go down? Did their antibodies go up? I mean, every patient is different. So I like that you test. There's also a thyroid adrenal connection. So can you briefly speak to that? Because a lot of my patients come to me saying, oh, I have adrenal fatigue. My chiropractor told me I have adrenal fatigue. I'm really tired. I did the saliva cortisol test. And they think, just fix me and you're going to fix everything. And it's not always that easy, but we do know that the adrenal glands help with thyroid hormone production. They help with sex hormone production. So what's this connection and what can we do about it to improve adrenal health?
Yeah, it's a very important question. And, to answer that question, what I say is that, our body is a symphony, right? It's not kind of, each and every instrument doing its own job. It's like all working together to kind of make our body function, optimally. So that's where, like this thyroid and adrenal connection also comes into place. So what are adrenal glands? So adrenal glands are like teeny tiny glands which are sitting on top of our kidneys, which are very, very important endocrine glands because they are secreting all these stress hormones like cortisol, your adrenaline, and all those things are secreted by our, adrenal glands. So what happens is that, whenever our body gets stressed out, or feel that it is exposed to any kind of stress, it secretes these hormones to protect our body from, those acute stressors that we might be getting exposed to. Now, these cortisols, again, the way they function is that, they go to the thyroid gland, sometimes shut off the production of the thyroid hormone, and also sometimes can interfere with the optimal functioning of the T3 hormone. Now, in reverse, what happens is that the thyroid hormone also controls, like how cortisol works. So again, like at the cellular level, sometimes these thyroid hormones alters how cortisol can make changes. So it's kind of a two-way connection that is present in thyroid and adrenal glands. So now what happens is that, in acute case, when we are exposed to stress, our cortisol gets secreted. That is a good thing because that is a defense mechanism. But what happens is that when our body gets exposed to chronic stress, then we have chronically elevated cortisol levels, and that's where we get into trouble. And that's what people talk about adrenal fatigue or kind of, adrenal dysfunction. And And that kind of comes along with the thyroid glands too, because in thyroid disorders like Hashimoto's, people are going through chronically stress all the time because of those antibodies. Body is inflamed, right? So that's what is happening. Now what happens is that unfortunately the symptoms of adrenal dysfunction or adrenal fatigue overlap a lot of times with thyroid dysfunction. So it's very, very difficult to differentiate, whether patients are adrenal fatigue or whether it is actually thyroid dysfunction. So there are some ways, that you can kind of differentiate. Obviously there are some symptomatic ways, and there is also testing ways. So in symptom based, if you have adrenal dysfunction, majority of the time the symptoms will be that there will be weight gain, but all of this weight gain will be around your abdomen. Okay, so that muffin top, or the terminology that we use, or that difficult to lose weight around your waist, that's what happens with it. The second thing is most common is that with adrenal dysfunction, people will always be kind of anxious or wired. That's what I call them. They will always be have like this underlying anxiety, and they will say, I don't know, but I just feel anxious all the time, and that's new for them. The third thing is that they're fatigued. And the fatigue is like basically they're just wiped out. It's just that as soon as they wake up in the morning, they are able to function for a couple of hours, and after that they're done. So that's a typical story of adrenal fatigue, that they will be just, able to function only for a few hours.
Wired and tired. Yeah.
Exactly, wired and tired. And the fourth thing is skin. So they have very, very fragile skin, like an old person. I don't want to mention that, but that's the best analogy I can come up with. Is as soon as they will strike something or somebody will scratch their skin, they will have a big wound. So that's very, very fragile skin is another sign of adrenal dysfunction. So those are the top symptoms. I would say that adrenal dysfunction or adrenal fatigue people will have.
I totally agree. I have a lot of patients with low blood pressure also, lightheaded and dizzy, very low blood pressure. So what do we do? What do we do about that? So how do we treat these briefly, how do we treat these adrenal cases? What do we do to help these patients?
Yeah, so there are a bunch of things that we can do. Obviously, again, for my philosophy is that, okay, well, first figure out that, why we're having this, problem of adrenal fatigue or dysfunction, right? So the first thing is that, okay, well, stress, right? Now, obviously, in the present scenario, stress is everywhere. We are getting exposed to stress. Just talk about present COVID situation. It is stressful each and every day because it's changing and nobody knows how long it's going to last, right? So similarly, we have work-related stress, relationship stress, financial stress. So first, I always encourage my patients to develop some de-stress techniques. Which can be easily like meditation or deep breathing, like cultivate a hobby, or just 5 minutes of, every day where they just don't do anything. Like you will be surprised that, when I tell people that for 5 minutes, try not to do anything, they say, yeah, that's easy. I said, okay, give it a try. And they'll come back and they say, the toughest thing you told me out of all those 10 things was not to do anything for 5 minutes. I was like, really? You said that would be easy? She said, yeah, but that was very tough.
I totally agree. I have a lot of patients, especially patients who are just wired and jittery, like you tell them to do nothing, because our bodies need downtime. I always tell my patients our bodies need physical and mental downtime aside from when we're literally sleeping in our beds. Like we need downtime during the day. And I'm sure with your profession and mine, I mean, we go all day seeing patients. I'm constantly talking to patients. I feel like at the end of the day, I'm like, what just happened? Because it's busy. So we need to honor our body's need for downtime and literally do nothing. And it can be difficult and our mind can wander, but that's so important. I think that's a very underrated, important tip. So I like that.
Yep. And the second thing is then I ask them, okay, after like cultivating or tackling the stress piece, then we use supplements called adaptogens. So these adaptogens are basically herbal or supplements, which help out, your adrenal fatigue or adrenal dysfunction. So top of my list, first is ashwagandha. The second thing is ginseng. And the third thing is rhodiola. So I think, a combination of these three like help out like majority of my patients go,
Yep.
go through this adrenal dysfunction or fatigue easily.
Totally agree. I love all of those. Yeah. We have a product called Adrenal Calm, which has those as well as some L-theanine and phosphatidylserine. So my patients who are just jacked up or feel jittery or irritable, who just need help calming their body down, help adapting to the stress. We have the herbs, we have the calming amino acid L-theanine, which is my favorite supplement on earth, and then phosphatidylserine, which is a calming phospholipid, both of which have effects lowering cortisol. So that Adrenal Calm product is just wonderful. That's something that many of my patients need. So
Absolutely.
I agree with you there. Well, that was all
Awesome.
very, very helpful. I have to ask what your top longevity tip would be. You gave us a lot of tips today, but what's your absolute top longevity tip?
So for me, as I said, magnesium is the key. Like there are so many things that we spoke about, but as I said, magnesium doesn't get the limelight as it
Sure.
should be, because like magnesium is involved in like more than 300 enzymatic processes in our body. So that's like one of the most like important mineral that our body needs to function. So it is involved in thyroid health. It is also involved in mitochondrial health. The worst part is that most of the clients are low in magnesium. The reason being our soil is deficient in magnesium. So there was
Yep.
a research study done, which again checked our soil to see if it has the same like mineral quality as like 10 years ago, and it showed that there are several minerals that our soil was low on, and magnesium was one of those. So even though we might be eating the most nutritious diet that on the earth, but then also we might not get enough magnesium. So that's the reason that's like an important thing that I always recommend to all of my patients, say that get magnesium, get magnesium, get magnesium. And the good part is that it is not toxic. So we have hardly seen any cases. People said, oh, like as you were mentioning that to find the right dose for them. So there is no toxicity of magnesium, so you can go on very, very high doses and still it will not bother most of the people, and it will not get toxic in the body. So then we can use high doses for people who need more.
Totally agree. Make sure you are purchasing a high quality supplement, though. That doesn't come from China. That's not laced with, things we don't want. Make sure it's very high quality, that it comes from a company that's testing their product for sure, which licensed clinicians like both of us, only recommend. So
Absolutely.
where can listeners find you if they want to connect with you?
So I have a website, it's called anshulguptamd.com. So that's where, all of my information is listed. I have a very, very active blog. So every day I'm researching more and more new things about Hashimoto's patients, and I kind of post over there through a blog about different things, at least once a week, I post over there. And then obviously I'm on social media, so people can connect me over there on Instagram or Facebook. So I do a lot of live videos for people to educate about those.
And we'll put all those links in the show notes, of course. Lastly, I know you have a free gift for our audience, so tell us about that.
Yeah, so like so I was talking about that, I always want to look at the root causes, of why people have Hashimoto's. So what I kind of figured out was that, why not kind of make a quiz for people to know that what root causes they might be going through. So that's where I prepared like an easy quiz, which can be done like in 3 or 4 minutes for folks, and that will give them idea of what root causes they might be suffering from or might be the reason for their Hashimoto's. So that's what the free gift I have for for your show for your show people who can take this thyroid quiz, and that gives them information about the root causes of their thyroid problem.
Wonderful. I'm going to have to take that myself. So we'll post that link in the show notes. Well, thank you, Dr. Gupta, for coming on the show today, defining Hashimoto's, talking about the mitothyroid connection, what the mitothyroid diet is, what supplements are important. And then just thank you for sharing your story and for giving our patients hope that they can recover and heal from Hashimoto's. It was a joy to have you on. So thank you for being here.
Yeah, my pleasure. It was really nice talking to you, and that's my goal, to kind of help so many people out, because I want to give hope. Because I was without hope and I had no plan. So I want people to know that they don't have to live this miserable life. There is a better life out there, and there is hope.
Absolutely. And I would say for listeners, finding a functional medicine provider like ourselves can help you personalize that plan to build your health back. That's what we do. That's what functional medicine is here for. So if you don't have a practitioner, find one.
Absolutely.